I now recognize Mr. Garcia from California for 5 minutes of questions.
Thank you, Mr. Chairman. And I first want to thank all of you for being here. I know that it's hard, particularly for witnesses and those that have lost family or friends. And I just want to say that I also lost both my mom and my stepfather during the pandemic. My mom was a healthcare worker. So this is a very serious topic, and obviously the issue around nursing homes is really tragic, and I think it's something that is a horrific experience that we went through that was going on across the country. I want to make sure also that as we review our actions around COVID-19 that we remind ourselves how uncertain we were at the very beginning. We did not have a lot of information. We were unsure what the standards were around washing hands, simple things that we were all panicked about groceries, about shopping, about what would be available, but the supply chain, there was a lot of uncertainty. We lost 1.3 million Americans. We lost 1,300 plus residents just of my own community. I was the mayor of Long Beach the entire time. We have our own health department in the city, and so managing all of that, particularly during the time when the spread was happening in nursing homes, was horrific. I also would agree that the governor of New York made some very serious mistakes. I think that's pretty clear. I think to anyone, whether whatever side of the aisle, I think we need to learn from those and recognize that there's a lot of loss of life amongst our elderly and our senior population, and that's something that's very serious, and I take it very seriously. But I also want to put in perspective that in the early days of the pandemic, the Trump administration, I also believe, failed in leadership. We had overwhelmed hospitals. We didn't have a lot of standards in our nursing care facilities. We didn't have enough beds available in our system. So those are things that are true. We also had shortages of PPE, and I remember as mayor having to personally go out and get PPE from other places, even outside of our own country, to get it to nursing homes and nursing facilities. It wasn't even always directly given to us by the state or the federal government. So these are not new. In 2019, the Trump administration also proposed a rule to relax federal requirements that nursing homes employ for on-site infection prevention specialists. So these are things I think that were huge mistakes. We also, I think, need to talk about the fact that nursing homes in general have not been well supported. Even before the pandemic, we know that low wages, poor benefits. I talked to numerous workers at our nursing homes in Long Beach that were suffering from issues around being overworked, having too many folks to take care of. And this was happening, we know, not just in New York, which we talked a lot about today, but nationally. Now, federal law requires all nursing homes to maintain 24 hours of licensed nursing coverage per day, including a registered nurse and on-site for 8 hours, but does not otherwise specify additional staffing requirements. Just want to note, the Centers for Medicare and Medicaid Services data showed the average staff hours for all nursing homes nationwide failed to meet federal recommended minimums, and certainly that also helped cost lives and the health of so many. So staff shortages, which were in place at the time, meant low quality care, folks seeing more patients, and certainly the spread of infections. We could have absolutely been better prepared. The federal government, absolutely under the leadership of President Trump, could have done more to prepare us and certainly given guidance to cities and to states. And so I think there's a lot to learn from, certainly from places like New York, where horrific tragedies happened, but also within the administration at the time. I want to note that low pay and lack of employee benefits did cause us issues in the pandemic, not just in nursing homes, but also in our hospitals. I want to just ask, just quickly, Dr. Grabowski, what does your research show about the role of the cohorting orders as opposed to factors like community spread and the shortage of PPE and testing?
Yeah, so our research really supports the idea that this was a system-wide problem. Nursing homes all over the country were impacted. I think one of the representatives said Arizona had much lower rates than New York. Well, Arizona also had much lower community spread. Look at the state where I live and work, Massachusetts, relative to New York. If it's in the community, it's in the nursing homes. We never had this mandate in Massachusetts yet. We had a lot of fatalities among our nursing home residents and a lot of cases and deaths among our staff too.
And briefly, how did the widespread shortages of PPE actually lead to really this mishandling? We were huge national shortages. I strongly believe the Trump administration failed in that respect. How did that lead to community spread and, a result, impact nursing homes?
Absolutely. So PPE is essential. It's our armor against COVID. Far too many nursing home staff lacked adequate PPE. Once again, the data that we put together during the summer of 2020 suggested 1 in 5 nursing homes, even by the summer, was still reporting a severe PPE shortage.
Thank you, sir. And I just again want to remind us that supporting our care workers is really important moving forward. Thank you, and I yield back.
Absolutely.
Now recognize Dr.